Information and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. And today I would like to introduce Olayne Perez, who is an APRN, and Ernesto Garcia, who's a DNP, and they are at Pure Beauty Center of Fort Lauderdale. The website is www.purebeautycenter.net, and the phone number is 954-708-1858. Thank you for coming to the show.
Thank you for inviting us.
Absolutely. I'm excited to have some great conversations here because I know I was just looking over all the different offerings that you have, and I'm so excited to learn about that. But let's first talk a little bit about your background and what made you want to become a DNP and ARNP. Tell us a little bit. Who wants to go first, Olayne?
Ladies first.
Sure. So my passion for nursing started back when I was in high school.
Oh, nice.
Yeah, because I went to a hospital called Mercy Hospital, and I started doing community service hours.
Oh.
And I did 104 hours of community service, and I didn't know a thing about nursing. I thought I wanted to be a doctor, and it was there where I learned that I wanted to be a nurse.
Nice.
So that's where everything started.
So those community service hours do pay off,
Yes,
right?
they do.
You got to learn about what you were interested in, and look at that, you continued that path.
Yes.
Nice.
Yeah.
Ernesto, you want to tell us a little bit about your background, and maybe
I'm a second-generation nurse. My mom was a foreign doctor in Cuba, and she instilled that in us to care for other people.
Nice.
And putting their needs before ours. So I was raised in a very selflessly way, and I wanted to use those powers given to me,
Nice.
to help people as much as I could. And what better foundation is, to enrich a person's life and to make them better and improve their quality of life.
I like that. So, from my understanding, this is a family business, is that right? You want to tell us a little bit more about the business and what brought upon this idea to open a business together?
So Olayne and myself, we've been in different practices, and I've had a few shortcomings in doing things the way that we wanted to, because there's always you want to do more, and you want to do more, and you want to do more, and unfortunately, if you're not at the helm, sometimes that's hard, and sometimes you have your hands behind your back. So we always wanted to do more for our clients, do more for our patients, and enrich their lives in ways that we were just very limited before. And we knew that the only way to really do that is to start our own office.
Mm-hmm.
I like that. And I see, I'm looking at some of the different treatments that you do. Well, first of all, you do the initial assessment, but then you do lab testing. Why is it so important for us to go in and do lab testing? Even though maybe, I feel great, I'm doing okay, but what is the benefit of us doing a lab?
It's important to do lab testing, because when we look at lab results, we're looking at it different, because we are putting together what the patient is telling us as what they're feeling with what we're looking at on paper. And then if the paper is not telling us, is not resembling what the patient is telling us, then we're going to try to find the root cause of why the patient is feeling that way, and we're going to work on making that better.
Yeah, root cause, I believe getting to the root cause as opposed to being, reactive and having to take a medication because we waited for years and now we have to take a medication. So tell us, why is it important to get to the root cause and learn about all maybe deficiencies or things that we can improve, optimize?
So not only do a lot of ailments and feelings and symptoms that you might have, they cause eventual organ damage and worse things, but also the medications that we take are very strong and that kind of mask the feelings, the things that you're feeling. Whereas getting to the root cause and working kind of outside the box finds a way to fix the problem and to make you feel better without the possibility of actually making you feel worse or masking things and having bigger problems down the line, where you can start implementing some lifestyle changes and eating differently, having exercise, and it's very specific things that we coach on to help our clients.
And it's very motivating for people. When you give them that power and you tell them, listen, no, we're not gonna have you take something, but we're gonna have you change this and this and this. Like, it's so exciting to see how they shine on the plan and they're like so excited and it's really gratifying to see how the patients feel, with this type of approach.
Yes. So many people, I hear so many different stories. They say they're going to their regular PCP and, they complain about whatever particular problem, and then the doctor says, well, you're in the range. So can you share with us a little bit more about, people think they're in that particular range of being healthy, but why is it that some of us, we're in the range, the normal range, right? But we have so many different, we're fatigued, we're exhausted, we have, I don't know, all these different ailments. So maybe you want to let us talk to us a little bit more about that.
Right, there's a lot of deficiencies, vitamins, hormones, and sometimes even crossing into so much as your cholesterol. Things that, well, okay, they're not red today, but you're tracking that way, you're headed that way, and that could change the way that you're feeling, to change the way that you normally do things, your activities, daily living, and you don't know why you feel bad because you've been read, your card, basically your lab results, and you just have no answer and you keep it going. Whereas we take a completely different approach of, even if things seem normal and numbers are normal, we'll still discuss line by line and every single result that we have on paper to treat our clients.
Because it's not the same thing as something being abnormal versus it being optimal.
That's right.
Like, you could have a normal B12, but it may not be optimal for your functioning, for you to have the energy to do the things you want to do.
Exactly.
Even though it looks normal on paper.
And
right?
things you used to do before also.
Or things that you used to do before.
Exactly. So why was it 6 months ago I was able to play golf 18 rounds and now I can't make it out to mini golf? So we find those things that bother our clients because sometimes normal, the usual PCP office is more like problem and resolution, where we're like, wait a minute, now how can we stop aging and then maybe turn back the clock so you can be able to continue to doing things you enjoy.
And you mentioned, I heard somebody say bioidentical hormones. I swear by them. Let's talk about bioidentical hormones, because unfortunately people hear hormones and they have this, I don't know, some people get fearful or they're maybe just not knowledgeable about bioidentical hormones. Can you share with us a little bit more about bioidentical hormone optimization?
So basically, we are composed of hormones. Hormones affect everything in our lives, everything.
Sure.
And as we age, our hormones levels go down. Sometimes so low that we are almost non-functional.
Right.
And we don't, and it's gonna give us symptoms like, like you've heard, like maybe you have a migraine, or maybe you're like super tired,
losing hair.
Or losing the hair.
Gaining weight.
Exactly.
Exhaustion.
And you're like, I'm eating well, I'm doing everything I'm supposed to do, I'm walking, I'm not losing the weight, and it's the hormones, So bioidentical hormones are really good for optimization of, of things that seem to be okay, but they could be better, like with the help of the hormones.
Yeah.
Exactly.
And so what I love about bioidentical hormones is it's just personalized to the exact, like I have my cream and it's whatever I need for my body. And how often do you suggest people come back to check their levels?
We do an initial evaluation where we check all your lab levels to make sure that we know
Right.
where we're starting. And then 3 months after that, we look at labs again as
Oh,
we,
nice.
and then
Tailored-
6 months after that,
tailored and customized.
we tailor and customize it to your specific needs,
Right.
It's very, very personal.
Yeah, it's I know it's a delicate dance because you have to get it just right, and so yeah, you're doing the testing so people can have that customized and tailored.
Exactly. So they can be the best and feel the best that they could possibly can at that given time.
Yes.
Is our goal.
And you know what's so underrated is sleep, healthy eating, exercise. Let's talk about
Sleep.
back to basics. Let's
sleep
talk about
is like such a big thing. Sleep. It's like, how are you sleeping? Like, that's
Right.
major thing. And what are you taking to sleep? Because, we don't know. And sometimes patients don't know. And they're taking medicine. They're taking like Tylenol, Motrin,
Really?
PM to sleep,
Wow.
and it's so toxic to your organs.
Sure.
And they don't know that taking magnesium could make a huge of a difference, and it's not going to harm your organs. You know what I mean?
Right.
So it's important to teach patients so they can make better decisions for sure.
We have aha moments every day in the office.
I
you know,
love that.
it's a lot of things that you just don't talk about. I mean, honey, how's your coffee this morning? This and that. And you go through your day, you go to work, you get back to work, and nobody really touches on the things. Oh, hey, what are you eating? Like how? Oh, I'm kind of feeling kind of bloated today. This and that. So let's recap. Let's go back. Let's talk about this. And putting the patient first and caring for them like they were part of our family is really what we do best.
I like that. I'm also looking at other offerings that you have, and there's just so many amazing things. You do the PRP, platelet-rich plasma. That may be something that people in our audience are interested about. Can you tell us a little bit more about that PRP?
Yeah, so PRP is going to help with like facial rejuvenation, skin tightening. It's a natural method because we are using the patient's own blood,
Yep.
their own plasma cells, and then we're subcutaneously injecting it under the skin, and then your body will regenerate that collagen, that elastin, all of those things that we need for our skin to be tighter, for our skin to be flowing, like more youthful. It's a natural thing. Like we're not putting anything, it's
Nothing synthetic.
no.
Right.
So that's why it makes it so great that it's not,
I heard it's also good for people, maybe if they have an ache or,
Yes.
or there are other
it's
benefits.
also
Could be
used for
injected,
joint
right?
pain,
Or
like
joint pain.
injected on the joints. It's used for different things, yes.
So for the PRP, is that something that you do sequence of treatments or?
Yes, you could do it as a sequence of treatments. I really like to combine it with other treatments,
Nice.
like a microneedling treatment.
Okay. Tell us
where-
about that.
So with microneedling, you're using little tiny needles to break the skin.
Yeah.
And then you put the plasma before it closes to help you have better results. So that's why I like to combine it. And microneedling is nothing, it's just little needles, so I'm
Right.
not putting anything synthetic or anything, It's your own body creating the elastin, the collagen, and all the things that you need.
And it's anywhere where the skin can be flaccid. It could be your abdomen, it could be your arms.
Yes.
Could be
Oh.
yeah, it's not just the face.
Okay.
Yeah.
Head to
to
toe.
Good to know. I like that. Okay, so I see you do other spider vein, age spots
Yes.
removal, tattoo removal.
Yep. Spider veins, noses, legs.
Yes.
You name it.
Nice.
With laser treatments, yes.
Oh, so you have laser treatments
And it's an immediate result. So it's amazing. Yeah.
for the veins.
There's a mirror. Yeah, there's a mirror that we have handheld, ready to go.
That is amazing. We have a quick commercial break. We're going to continue the conversation when we come back.
Thank you.
Okay.
Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor. I am with Olayne Perez and Ernesto Garcia, and they are at Pure Beauty Center of Fort Lauderdale. The phone number is 954-708-1858, and you can find their website at www.purebeautycenter.net. I'm enjoying this conversation because I know that when I do something for myself, I feel better. And if I look better, I feel better. So it's a synergistic type of thing going on, right?
Yes, definitely.
And we see that in all our patients.
Yeah. I see you do, I'm looking at other treatments that you do. Treatment to improve body, skin tone, and texture. What would that look like? What type of treatments to improve body, skin tone, and texture? I'm all about learning all this.
Yes.
What do you do?
We have different modalities.
Nice.
Nowadays, sometimes like people are really like paying attention, and a lot of the times they want to lose a lot of weight.
Sure.
And they get on medication to lose a lot of weight.
Oh, yes. People are losing weight fast, right?
Fast.
Faster than before.
So we have
Better
treatments to help so that most, that laxity,
Yes.
to help with the laxity. So we use a machine that helps tone the muscle so that your skin doesn't look saggy. So we have treatments like those. We have also body sculpting is for target like stubborn areas that bother people sometimes. We have treatments for that too.
To burn the fat.
Yeah,
burn the
I
fat,
can see because some people are taking these GLP-1 medications and they're losing weight fast, right? So I can see.
Yeah, especially for men. Sometimes we wear our belt a little high, a little tight, and a little too long, and we have these chichos. No matter how these side
love handles.
Love
handles.
handles.
We have our love handles that nobody can handle, and and even though you're losing a lot of weight very quickly, like that could be stubborn fat that's stuck there, and so that's what our body sculpting machine is excellent at burning that stubborn fat and having your lymphatic system flush it out.
Yeah, let's talk lymphatic system. So let's talk about that. What are the benefits of having some good lymphatic drainage?
The massage.
I mean, the benefits are endless because, it optimizes everything in your body if you're draining the right way. Like if your lymphatic system is working how it's supposed to work.
Right.
A lot of the treatments that we do, it gets, like the body sculpting, you get rid of that fat cell, like through the lymphatic system.
Nice.
So it's a combination. That's why we care so much about lifestyle modifications, because we don't gain anything by doing these treatments.
Right.
If we're gonna go home and we're not gonna have a plan.
That's right.
It's nobody's fault. If you don't give somebody a plan, they don't know.
Right.
So it's good to have a plan. So when you go home, you're making these changes and you're drinking the enough water, and you are walking and you are eating the right diet, to help yourself so you can have the best outcome, and also so that it's longer term. It's not just depending on me or my clinic to do these
Sure.
treatments all the time. It's me making a change on my life,
habit, yeah.
a habit.
A habit.
So that I eventually, they don't depend on the treatments.
That's right. And then they look good, and then they can say where they went, and then it's a good reflection on you.
Right. Their well-being and our well-being depends on their health.
Yes.
Exactly. Exactly. So, what else? What other treatments did you want to talk about? I know. Glutathione and NAD therapy. That's a big one.
Yeah.
What are the benefits of having that?
I mean, it depends on your goals. So if it's not the only thing that's there, and it's
Sure.
not what I always go for.
Of course.
I want to start making the foundation better.
Okay.
But yes, I'm open to helping with the medication. But like I said before, like lifestyle modifications for me, like I really encourage that a lot.
Sure.
But yes, we do use whey. We have different whey protocols that we can
Sure.
use with semaglutide to help lose weight. Yes.
And so glutathione is good. Is that our natural antioxidant in our body? Glutathione?
GLP-2?
Yes, is a natural antioxidant in our body also.
Oh, okay. Nice. And then what else? What are some of the popular treatments that people are getting?
Oh, the bread and butter would be a lot of injectables, like Botox and fillers. So we do that as well, because not only does the client feel immediately better and they look better, so that's very fulfilling for us, for them to look
Nice.
better. That's instant gratification. But also when they start feeling better because they look better, when they have more confidence, when they're able to get out more, and those kind of things are very fulfilling for us too. So it's like a two-step kind of thing for us.
Yeah. And how frequently would somebody have to come back and get like a touch-up?
For Botox, after the first treatment, it's 2 weeks to see how. Yeah, we offer that for free because we're very concerned with the outcomes. Sometimes some people react differently. They might not have used the toxin that we use. Maybe they used a different
Okay.
product. And so we like to see somebody in 2 weeks. And then generally, the effects last for about 6 months. So between 4 to 6 months, we'll probably see them back. Obviously, you want to be ready for the holidays. You want to be ready for summer. So it's calendar dependent.
Sure, sure. Are more men doing these nowadays?
Surprisingly, a lot of guys. I mean, my barber, I've hooked them into it.
Okay.
The person that I deal with business, I hooked them into it. A lot of men are caring more and more about their
Good.
appearance, and I think emotionally at all, our guys are expressing themselves a little more and feeling a little better, and it's absolutely fantastic. We don't have to just bear this weight by ourselves, and now we can say, hey, I don't like this wrinkle, which was maybe like not
Right?
not a topic discussion at a bar generally, but I think it's just as important for men as it is for women that
Absolutely.
you look good. We all have mirrors, for men's mirrors aren't blurry, and and women's mirrors are more clear. It's just as important as you look, and sometimes you don't realize it because as men we go through the day and it's just not something we think about, other responsibilities, other things, but
Sure.
man, when you do have some time to look yourself in the mirror, like, wow, I need to
That third
fix
day
that.
comes in and you're like, wow, it's already
Yeah.
looking better.
Right, that
Wow.
third day with the Botox is
That's
something
good.
incredible.
That's good. Any other treatments that are popular that more and more people are starting to
I think honestly our
do?
biggest treatment is the free consultation.
Let's talk
because
about that.
honestly, we like it when people know what they want, but we also like it best when people know what they want to fix and let us. Sometimes the drooping of the face can be fixed with filler, and people don't know that. Where you don't attack this area, you work it somewhere else. Sometimes people want filler in their lips, and that's not the best thing. Maybe with a tiny lip flip, we can fix that. So I enjoy beautifying people in my own way, which is kind of very, very interesting for me. And so I really have to harp on the free consultation.
Very good. So this interview has gone so fast. We literally have like 2 minutes left. And if you want to share any other, success stories or call to action, you guys have a couple minutes, you can certainly to share with us.
You want to say one and I'll go after you?
No, I mean, we just want you to know that we're here for you. We're here for things that you may not even be thinking of. We're here to listen to you.
Nice.
Sometimes you just need somebody to listen to you, because sometimes you think you're losing it, but somebody gets to listen to you, then we can, help you see that something may be happening, and we can help.
That's important, because how many times I hear people going to doctors, they didn't listen to me, or I told them one thing, and so that's huge. So we appreciate that.
I hear that from my patients.
Yeah, absolutely.
There's a lot of treatments that people might be scared of. So with a small, conversation, we could talk about the pain levels, and it's practically not there to get rid of some of the things on your face or your body that might be bothering you. And sometimes people allow them to go on years. So they'll be 2, 3 years old, and now this blemish becomes a toddler, and you haven't gotten rid of it. So just a small conversation, and we can help walk people through it.
And we will offer 20% off all of our services to everybody that's listening to the show.
Okay, let me give your number out again. 20% off. The number's 954-708-1858. Just let them know you heard them on You and Your Doctor.
Yes.
Thank
Thank
you
you
so much.
so much for
Thank you
coming
so
to the
much.
show and educating us on your
It
programs.
is our pleasure.
Thank you.
Absolutely.
Thank you.
Thank you. Great night.